Assalamualaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I will be explaining to you the very important topic of the endocrinology, which is the iodine deficiency in our body. That what happens, what are the consequences of the iodine deficiency that occurs in our body. First of all, we have to understand that what is the mechanism of the iodine deficiency and what does it causes in our body. So iodine is actually required for the synthesis of the thyroid hormone. This is obvious, we know that. And thyroid hormone actually maintains the normal metabolism in our body in order to produce the constant heating and the energy in our body, which is the metabolism. Now, talking about the synthesis of the T3 and T4 hormone, which is thyroid hormones. So, first of all, we must need to know that iodine is enlarged in our body in the form of the iodate. Then it is converted into the iodide in the stomach, where it is you can say converted into the iodide from the iodate, and then it is transferred into the extracellular fluid, where thyroid gland actually picks up that iodide. And then what happens from the extracellular fluid, 75% of iodide is being absorbed into the thyroid gland because it requires for the production of the thyroid hormones. So that's why it is a very noticeable feature that the concentration of iodide always remains less in the extracellular fluid. Now, why the concentration of iodine remains less in the extracellular fluid? Because 75% of iodine is absorbed in the thyroid gland for the synthesis of the thyroid hormones. So furthermore, we will discuss what happens that after the thyroid gland picks up that iodide and then uses it to synthesize the thyroid hormone. So this is due to this 8 to 10 milligram of iodide always remains accumulated in our thyroid gland. So that's why in normal individual, the intake of iodine must need to be 150 microgram per deciliter. And if we talk about the pregnant women, for pregnant women, more iodine is required. So the iodine intake must need to be 220 microgram per deciliter for normal individuals. And for pregnant women. After this, those women who are lactating their baby or who are doing breastfeeding, they must need to have an intake of iodine 290 microgram per deciliter for lactating women, because they need iodine for themselves and as well as for their infants as well. Now, talking about that how the T3 and T4 hormones are synthesized. So these T3 and T4 hormones are synthesized under the influence of the TSH releasing factor from the anterior pituitary. So TSH released by anterior pituitary governs the production of T3 and T4 hormone by the thyroid gland. Furthermore, this anterior pituitary is also being influenced by the thyrotropin hormone that is being released by the hypothalamus. So TRH, thyrotropin hormone from hypothalamus stimulates the anterior pituitary. So if there is, you can say, any type of abnormality in any of these organs, you can say that the production of the thyroid hormones will be disturbed. So talking about the two types of hypothyroidism which results in the abnormalities in any of these organs. If we talk about the primary hypothyroidism, so which occurs due to the abnormality in the thyroid gland, which is unable to produce the T3 and T4 hormones. So what happens that the production of TSH is normal from the anterior pituitary, which means that TSH levels are high, But if you talk about the thyroid gland, it is damaged, or it has some type of abnormality. So in the case of the primary hypothyroidism, the TSH level would be high, but the level of T3 and T4 hormones would be less. If you talk about the secondary hypothyroidism, which is due to the any type of other cause, maybe damage to the hypothalamus or maybe damage to the anterior pituitary. So what happens that due to the damage in the anterior pituitary, TSH levels would be very low, TSH concentration would be very low, and due to the decreased concentration of the TSH, the production of the T3 and T4 hormones would also be influenced. So that's why the TSH levels would be low, side by side T3 and T4 levels would be low as well. So now talking about the sources of the iodine. So due to the limited sources of iodine, this iodine deficiency is very much common in the humans. So sources of iodine includes seaweeds. We know that seafoods are the abundant sources of the iodine. After the yogurt, then egg, and then iodized salt. So these sources must need to be uptaken by the humans so that they can prevent themselves from the iodine deficiency. Now talking about the symptoms of the iodine deficiency, that what are the symptoms? What you can say are those signs which help us to recognize that the person is suffering from the iodine deficiency. So first symptom is the swelling of the neck, which is the goiter. Swelling of the neck, most commonly known as the goiter. So swelling of neck occurs because thyroid gland needs iodine in order to synthesize the thyroid hormone. If the thyroid gland is not getting the enough iodine from the external sources, it would forcefully try to produce the thyroid hormone, thereby resulting the proliferation of the cells and division of cells would occur, which would actually cause the swelling of neck and the enlargement of our thyroid gland. Then talking about the weight gain. Now we know that the thyroid hormone or the thyroid gland is responsible for our normal metabolism in our body, converting those calories into the energy. So if in the case of the deficiency of the thyroid hormones, what would happen that those calories would not be converting into the energy, so it would lead to the accumulation of those calories in the form of fat in our body, which would lead to the weight gain. Then talking about weight gain, we have the fatigue. So that is very much obvious that the person and the metabolism in the body is not normal. So that's why the person would be suffering from the fatigue, as the metabolism is not occurring in a normal way. Now, the next symptom is the hair loss. So hair loss occurs because thyroid hormone is involved in the regeneration of the hair follicles. That's why hair loss is the another symptoms of this. Dry skin, dry flaky skin. So dry flaky skin occurs because the thyroid hormone is involved in the production of heat, in the production of the you can say maintenance of the normal metabolism in our body. So it produces the sweat, so that it can actually keep our external skin moist. So due to the less production of the sweat, what happens that the moisture of the skin is not that enough in the case of normal. So due to the less moisture on our skin gets dry. So this is also the symptom of the iodine deficiency. Then number 6, we have the irregular heartbeat, or you can say bradycardia. Irregular heartbeat or bradycardia, you can say. So as the energy is not being generated in our body in the normal, you can say in the normal amounts, so that's why the heartbeat would decrease, leading to the bradycardia. And also there is the malformations in the brain development as well. Malformations in the brain development as well, which can cause the, you can say, altered learning process, which can lead to the altered learning process. You can say your learning and memory would be affected, because you know that the hippocampus is responsible for maintaining long memory, so it requires thyroid hormones. So if thyroid hormones are in deficiency or not present in the abundant amounts, what would happen that our you can say brain development, there would be malformation in our brain development, and also there would be a hindrance in our learning as well. After this we have the symptom that is the excessive menstrual cycles in the female. Excessive menstrual cycles. So excessive menstrual cycle would occur in the female because thyroid hormones are involved in the, you can say, in maintenance of the normal period of the menstrual cycle. So if thyroid hormones are not present in the abundant in the required amount, what would happen? It would lead to the excessive menstrual cycle with the loss of bleeding as well. And the last symptom I would write here is the intolerance to the cold, which means that a person would be feeling more cold as compared to the normal circumstances, because there is the very much less production of the heat in our body. Now, at the last, I will tell you about the diagnosis, that how this is diagnosed. What are those procedures? So, talking about the diagnosis of this iodine deficiency. So, first test that is performed is the urine test. We check the amount of iodine present in it. Then the second is the blood test. We take in order to detect the amount of iodine in it. And the third, it is the iodine patch test. So this iodine patch test is very much interesting. Why? Because what happens, the iodine is, you can say, the patch of iodine is created on our skin. So if the person's you can say iodine level are normal, that iodine patch would not be disappeared. But the person who is suffering from that iodine deficiency, what would happen, that iodine patch would be disappeared. Why? Because all of those iodine would be absorbed by the skin as the body is demanding the iodine. So I have told you about all the aspects of the iodine deficiency in this lecture, and hope you have understood my lecture well. And last but not the least, don't forget subscribing MS Lectures. Thank you.